Rumpel.
I'm Dr. Trin. Nice to meet you too.
I think we're early for the convention. So, what kind of doctor are you?
I'm a dentist.
Dentists diagnose and treat problems with teeth and tissues in the mouth, along with giving advice and administering care to help prevent future problems. They provide instruction on diet, brushing, flossing, the use of fluorides, and other aspects of dental care.
How about you?
I'm a pediatrician.
Developmentally oriented and trained in skilled assessment, their patient care lens is focused on prevention, detection, and management of physical, behavioral, developmental, and social problems that affect children.
How are the working conditions?
Well, most dentists work 4 or 5 days a week. Most full-time dentists work between 35 and 40 hours a week. However, others, especially those who are trying to establish a new practice, work more. What are your working conditions?
My office is usually filled with screaming children. I normally work about 50 hours a week and usually see about 125 patients a week.
Wow, this may be a personal question, but what is your annual income?
Well, I make around $160,000 a year.
Me too.
So, how do you prepare for dental school?
In high school, I enrolled in college preparatory classes in chemistry, biology, and algebra. I got a broad exposure to science and math and a well-rounded liberal arts education. Once I was in college, I built a solid foundation in the natural sciences, especially general biology. Psychology and business courses also provided me with an important background that increased my success as a dentist. I didn't have to major in science, but I had to complete the pre-dental science courses. What about you?
To become a pediatrician, you need to also study chemistry, sociology, and physics. They also take math classes to learn how to solve equations. They must earn a bachelor's degree. After college, students need to attend medical school, but they must take the medical college admission test, MCAT, before they do so. So, do you need a required license in order to become a dentist?
Yes, I do. A dentist is required to have a license in order to practice. In order to get the dentist license, you must complete accredited dental school and pass the written and practical sections of the licensing exam. What about you?
Yes, pediatricians are also required to have a license. Pediatricians need a license to practice medicine. They need to get their license in a state or province they want to work in. They must pass both the residency program and licensing exam.
The dental healthcare industry are having problems with supply and demand. There are not a lot of qualified dentists in this field. Compared to mine, is your occupation in high demand?
Formal education of pediatricians and the training requirements are amongst the most demanding of any occupation, and the earnings are amongst the highest.
I just realized we have something in common. We advise people on issues concerning diet, activity, hygiene, and disease prevention.
I'm just wondering, what are the benefits of being a dentist?
Dentists treat people, not just teeth and mouths. We interact with people of all ages, cultures, and personalities. A typical day is diverse and interesting. Dentistry allows you to be your own boss. We can balance our personal and professional lives to meet our individual needs and desires. And what are the benefits of being a pediatrician?
You can start your own office and be your own boss. Join a group of doctors and share some responsibility. About 15% of pediatricians work part-time, leaving you more time to stay home with your family or pursue other interests. And pediatrics isn't all about runny noses and ear infections. As a pediatrician, you can be as challenged as you want to be, taking care of kids with complex medical problems such as diabetes, depression, and asthma. Well, I think the convention is about to start. Nice meeting you, Dr. Tran.
Nice meeting you, Dr. Chantal.